Good afternoon.
On the bottom right.
Glad to see everyone here today, June 13, 2022, for the Wright County Health and Human Services Board meeting. If we could all stand for the Pledge of Allegiance, please. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, first item, a review of the board minutes from 5/9 of 2022. Anyone have anything to add, change, or delete?
I'll make a motion to approve the minutes.
I'll second that.
Motion made and seconded. Any further discussion? If not, all in favor say aye.
Aye.
Opposed? Motion carries unanimous. Next, review and approval of the agenda. Anyone have anything to add or delete from the agenda?
I'll make a motion to approve the agenda.
I'll second that.
Motion made and seconded to approve the agenda. Any further discussion? Hearing none. All those in favor say aye.
Aye.
Opposed? Motion carries unanimous. Next, consent agenda. Anyone have anything to add or change on the consent agenda? I have one thing which I spoke to Jamie about earlier, to pull for discussion. Under letter A, then it's got letter C. No,
Or B.
B. Approve the grant funded out-of-state travel for a couple employees.
Mr. Chair, I'll make a motion to accept the consent agenda
I'll
with
second
that
it.
one item removed for discussion.
Okay, motion made and seconded. Any further discussion? If not, all those in favor say aye.
Aye.
Opposed? Motion carries. All right, so
I'm
that,
glad you pulled this one because I don't know why people would want to go to Florida in July. I would thought,
We
you
go
know,
where we're called. Mike.
December or January would be much more ideal.
Maybe the rates are cheaper in July.
Well,
Well, I'm sure staff would agree with your recommendation to do it in the wintertime. I do have both John and Becky Graham here to answer any questions you might have, and you could step up to the podium, John and Becky.
hello.
Hello.
Thanks for coming in, and I talked to Jamie this morning, just go over the agenda ahead of time, and if anything gets my attention for discussion and questions, so she can prepare the right people to come in. So on this one, there just isn't a lot of background or description about what this is for, what is covered by the grants, if it's the tuition, travel expenses, and wages, how that all shakes out, because it looks like about 5 days worth, and what you hope to gain from attending, for starters.
Yes, so Commissioner Ketchmark, the Drug-Free Communities Grant will pay for staff salary, expenses, travel, airfare, lodging, and the materials that you guys need for your training. And I'll let Becky talk about the requirements of CADCA.
Sure. Hi, Commissioners. Becky Graham, Public Health Nurse, also the Drug-Free Community Grant Program Director. So for the DFC grant, CADCA, which is our training coalition, it's Coalition's Anti-Drug Use of America, so it's this big, they do all the training for DFC recipients, some of which are required, some of which are just strongly recommended. So this one is the Mid-Year Training Institute, so it's a little bit more in-depth learning about how to build your coalition, how to scan your environment to see really where your problem spots are, and really just sort of how to engage you. So it's really a deep dive into trainings. And yes, it is 5 days of training, 8 hours of training each day with some introductions and stuff at night as well, so.
Okay.
We could not send staff last year because of the COVID pandemic that we're a part of. So this is the first time that this has been opened up in 2 years.
And prior to that, did you go regularly then? Or
No, we just have, what are we, year 2 of DFC?
Year 2.
We're on year 2 of this new Drug-Free Communities Grant, so we have not gone in the past.
And I was part of some CADCA training also, filled in a day or two, and we have, I mean, it's intense. We had 2, I think, 5-day trainings.
3
haven't we?
weeks, so 3 separate
3
weeks.
weeks, yep. And so anyway, it's very, very good information. It's very helpful, and so I'm glad to see that you're going personally. So
Mr. Chair?
Yes,
From
Commissioner
what
Gillette.
from what I know of Rebecca Graham, that she'll put it to good use, the information.
Thank you.
And
Yes,
the
we have good
education.
ideas.
And with that, I'll make a motion to approve the grant funded
I'll second that.
out-of-state travel.
Okay, motion made and seconded, and for discussion, I had two more questions that he slipped the motion in before I got to ask, but could you bring back what you can pass along to better the county and your department to maybe the next available Health and Human Services Board meeting after you get back?
Of course.
Because it is 5 days, it's covered. It's good to hear the wages are covered too by the grant, because that's not always the case, but I wanted to ask about that too. And so when you're at this training, is your workload sitting there till you get back, or does somebody pick up what you normally do so you don't have to be worried when you come back that you got a stack of stuff on your desk to finish that sat there while you were gone?
Yeah, Becky is a employee that wears many hats within our public health department, and she's very good about finding backups when she's out of town. She gets all her work done ahead of time before training, and part of the main thing that we had going on 2 years ago was the pandemic response. We would never send Becky out-of-state travel during a pandemic response, but we're in a better place now that we can afford to let her go for 5 days for training. And then she just does a marvelous job of keeping all her work up and doing her job duties before she leaves on travel.
Okay,
Mr. Chair, so a lot of the drug-free communities grant and Becky and Lori's efforts for a
Rachel.
while as a coordinator, and now Rachel, they've already been using this with the mentorship, education, and drug awareness. So they've this CADCA and the grant has really helped add a lot to us, our coalition.
all right, thank you.
Mr. Chair?
Yes, Commissioner
Hey,
Deloy.
can you just state a little bit again? Because the way it sounded like you wanted them to spend 5 days explaining to us what they learned there. Can we make sure that it's not 5 days worth?
We probably could.
Sure, if you're willing to then change your motion to include that they come back and give us a brief summary of what they learned and how we can improve our service based on your 5-day training at the next Health and Human Services Board meeting. How's that?
Or come to our meeting, right?
Even better.
Yeah.
Commissioners, I also let Commissioner Ketchmark know that in the future, instead of putting the out-of-state training on our consent agendas, that we would include it as a timed agenda item for the foreseeable future, so we could not need to pull these and just discuss them as they come up.
Sure, I appreciate that, and you can have staff that can come and speak to that. So are you good with amending the motions to include a brief summary of their experience
You had
there?
already requested that.
Yeah.
And
Okay.
I know Rebecca and John, they will do that.
Okay, all in favor, say aye. Aye. Opposed? Okay, motion carries.
Just
for
want to make
training.
sure they weren't going to do 5 days worth.
All right,
Thank you.
all right.
Thanks.
And we got next regular agenda. Staffing announcement, a new hire, and
Yes, thank you. I would like to invite Brianna Johnson to approach the podium. She's really excited about her opportunity to address the board.
so congratulations, Brianna, and as the chair, I'll say it's good to have you here. I know that sometimes it can be uncomfortable to speak in groups. That's not typically maybe part of what you do, but I'll leave it up to the rest of the board if they want to go into deeper questioning of you, but that'll come from them, okay?
Thank you.
He's afraid. So where are you from?
I guess my first half of my life was kind of in the area of like Princeton, Big Lake, and Buffalo, but I ended up in Maple Grove, and that's where I graduated high school from.
Is that where you live now then?
I live in Otsego now.
Ah,
In the Wright County.
yeah, works for the right county, lives in the right county. You're doing everything right.
Thank you.
What else do you need? Perfect, huh?
Thank you.
Board, Brianna is a new social worker in our waiver and community supports area, and she reports to Leanne. And we're very happy to have her on board as of June 6th.
Yeah, welcome.
Thank you.
Yes, welcome.
Thanks.
Thank you.
All right, next, employee of the month for July.
I'm very happy to let you know that Roseanne Duran is our July Employee of the Month. Roseanne is currently on a well-deserved vacation, and she will join us next month along with the August Employee of the Month to come and see the board. So Roseanne Duran,
Okay,
thank you.
congratulations to her. Next, we're looking at approving a resolution, HHS 22-04, for the county health plan recommendation.
Yes, board, this is a resolution. If you recall, I think at the May board meeting, there were 2 resolutions like this. So for each of our program areas that uses medical services or medical assistance type of services, this is I think either on a 3 or 4 year procurement basis that they ask us a lot of questions. Taryn Anderson, one of our social services supervisors, sat on a committee to go through all of the very extensive information regarding them, all the different programs or different providers that can provide this service, and they determined that the top ones for Wright County would be approving the proposals from Blue Plus, UCare, Health Partners, and Medica. Then we would find out after the resolution passes, I hope passes and goes on to DHS, we would then hear from DHS whether or not we were successful in getting those providers. Since we were here in May, we did hear back from DHS, and we were awarded the providers that we had requested, that the board had signed the resolution for. So we are not one of the counties that's going to appeal or have any kind of process to go through that. If you remember, we did that about 5 or 6 years ago, and it was kind of a heavy lift. So far, we are good with the providers that have gotten to this point.
I'll approve the resolution HHS 22-4 for family and children county health plan recommendations.
Okay,
I'll second.
motion made and seconded. Any further discussion? Just a comment, I see in the narrative that you thought Medica did a good job, and we went away from them many years ago. When I started here, we had Medica. I thought it was good. And then powers above me, of course, made the switch, and I don't know if anyone here was here when it went from Medica to the next group, but we had that for a while.
Partners when we came on board.
Okay,
We've had them for quite a while, and I believe that was one of the ones that we went back to ask for when we were appealing the decision the last time, was to include Medica in our
And this is a
selection.
little different
is all
situation than our
PMAP.
personal.
This is all
insurance.
PMAP, yeah.
Yep.
Yep.
Because we were wasn't it just 2 years ago that we were singled only to Blue Cross Blue Plus was the only one that came out of it for, was almost 2 years, I think.
Right.
Because there used to be a choice that you'd have between UCare and our preferred one or whatever
You
it
know,
was.
and even if they are kind of like, they provide like services, one of the issues for us, of course, is that if we are not renewed with one that a lot of our more than, I think we're probably somewhere around 12 to 15,000 people or families that carry medical assistance on some of these programs, we would have to then go through the whole process of changing them over in our systems, which is a huge endeavor. So if we can keep the ones that we currently have, people can still switch between them, but those are just on the onesies, and we don't have, 1,000 people that we have to move from one program to another.
okay, a resolution, Commissioner Delighten?
Aye.
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 Aye. Motion, resolution passed.
Thank you.
Okay, information on HHS advisory community minutes from Jamie.
Yes, I actually was not at this committee. I was at a training up at Rutgers and had an excused absence. However, we did welcome, this was our HSAC meeting on May 25th. We had updates from both our mental health committee and our public health task force. Commissioner Hewsome was present, and she and Kim Johnson provided information regarding where the county was at with ARP funding and what's going on with that. So there was some discussion around the county ongoing fund approval toward administrative costs, 4-H, mental health services, household assistance, the drinking water distribution in Howard Lake, broadband, of course, and others. They also discussed the HHS financial services. Emergency general assistance funds are already expended. That's a calendar year that ends, I believe, the end of June. So those do run short about this time of the year. And using ARPA funds if there's a COVID component to the emergency application. in that area. Discussed homelessness and prevalence in the metro versus in Wright County. They also had, Kim is going to be bringing to the next meeting the percentage of homelessness in Wright County, and we have several information that we can provide around what that looks like. Then under the open forum, we shared the 2021 annual report, which we shared with the board, I believe also in May. And Kim Johnson shared the 2021 cash and supplemental nutrition assistance programs performance report, which was quite extraordinary in that Wright County hit 78%. And that was beyond the 55% threshold that the state has for the expedited SNAP applications process. And if you recall, a few years ago, we were nowhere close to that. And we also scored at 81.8% with a 75% threshold on the applications process timely.
All right, thank you, Jamie. Just a couple things. Could you relay then to the next board meeting what you find out for the percentage of homelessness in Wright County?
We can certainly bring that in. Will be part of our,
be part of the next.
this won't meet again. I think we meet on the odd month. So this will meet the end of July, so it'd probably be the 1st of August.
Sure,
meeting
whenever
that
it
we'll
works
bring
out
that
and you
back.
have it. And then Diane sent me something, maybe all the commissioners, about some proposed help at some of our housing in 2 cities for homelessness. Can you maybe include that as a kind of our response for the need, and how there's a couple communities that
Sure.
there's going to be, they're going to address that with some units that'll be set aside for potential homeless people?
Okay, so if I'm understanding you, what we look at is like the kind of the county as a whole with homelessness percentages, and then Diane is actually here today, and she could maybe, if you have any questions regarding the information that 3 of the commissioners received about proposed housing developments within your districts, she could maybe address any questions you have during our director's comment at the end of this meeting. I'm not sure that it's going to overlay with what we come back with the homelessness, because these proposals are kind of independent of looking at that piece of it. So it's maybe 2 topics versus 1 topic.
Okay,
Mr. Chair, there's 3 workforce housings in St. Michael. If I remember correctly, they, out of each apartment complex, they leave 4 for homeless. Now, unfortunately, which irritates me, is that the county has no control over what homeless or who homeless goes in there. That's all done by Lutheran Services?
Well, it's continuity of care, coordination and entry, and that's through, is that under the COC? Okay, so it looks at, has many counties, and then they would potentially put somebody who's homeless into any, and likewise, Wright County people could potentially go to a housing development that's in another county as well. But you're right, we don't have, Diane can speak to that later a little bit, but we don't have as much control over those, who goes into the homeless apartments as we do.
COC,
with
what
like,
is?
COC is a, I think it's central Minnesota, I'm trying to
what-
think, it's coordination.
Is that the one out of St. Cloud? Because don't they also own a couple apartments in Rockford that are low
Well,
income?
the COC doesn't own the apartments, they're kind
They're
of,
just
they're an
operational?
umbrella,
Okay.
yeah, over a lot of counties and things like that.
So are
And,
they a nonprofit or are they a government agency?
They're a nonprofit, is my understanding, and they work with government agencies and nonprofits.
So they're basically to uphold their equal opportunity status is basically what they're the vetting agency.
I believe that's part of it.
And it might be first come, first served type deal too.
It could be.
You know, it might not hurt to ask them to come visit us.
Right, so,
Board.
and what Diane and I were discussing, I think last week, is that and these are all proposals, and sometimes they get off the ground and sometimes they don't. Last year, I don't think either of the ones that we brought forward made it to the next part. But there's also some people with disabilities apartments in there, and those the county does have more control over. And Diane has been kind of, I wouldn't say negotiating, but working with the people with the housing plans to make sure that that does go through Wright County and that we have first placement on those apartments.
okay, maybe we can go to your comments, and as you suggested, maybe Diane, I think, sounds like we maybe have a couple of questions for clarification today, but if you're not prepared, we can go into that the next time also, but.
Do you want
Go
to, we
ahead.
could start with that. If you have, Diane, I saw, does have a bunch of her materials with her. If you have any specific questions, I believe there were 3 proposals that she contacted each of the commissioners that have a proposal in that area. I think 1 or 2 of them were actually expansions of existing housing, which we were kind of excited about, and then 1 or 2 of them is a new proposal.
Oh, thank you for coming up. So what is the screening process, or do we not have anything to do with if somebody steps up and says, hey, I'm homeless, or someone on their behalf says, hey, I live in the Delano area, or this person lives, or is from the Delano area? How is that decided on where they're gonna go?
So when a person is identified as long-term homeless, they complete a vulnerability index. The initials are VI SPDAT, but it's a vulnerability index to indicate level of need currently for that person. And so based on that vulnerability index, they're placed on a list for housing. And so that's managed through the COC, Continuum of Care, through that coordinated entry group. So that's managed currently by Central Minnesota Housing Partnership. They're a person that runs the COC for our larger county area. So it's there's lots of counties within the COC. I don't think I could even name them all. So once they determine that, then they ask them, where do you want to live? So do you want to live in Wright County? Are you from Wright County? Or if you're from St. Cloud or another area, are you willing to move to Wright County? And then based on where the openings are for those homeless units, then that's when that person is at that list, they say, hey, here's a homeless unit. It's in this community. Do you want to apply? And then they apply for the apartment like anyone else would, and go through that process.
And you,
Oh, so back up a little bit. So when people apply, they are getting referred from the Wright County Health and Human Services, or are they going right to the Central Minnesota Housing, or are they going right to COC? Just curious, like how they go from A to B to C.
It can be a variety of different ways. So it could be a referral from us as Health and Human Services directly to that list. It could be from us to another entity, like Salvation Army works closely with our homeless population in Wright County. So they have the ability to complete that vulnerability index and then place an individual on the coordinated entry list for housing. So it can be a variety of ways.
so the financial arrangement is between that COC and the owner of the housing unit, if there is any financial transaction?
Right, so the financial piece of how the housing is paid for is that individual applies for housing support. So that would be an application that they complete through our financial services area or the financial services area in the location that they want to live.
So does it come out of your budget at all to help pay, or where does the money come from?
That would be, like, if it's a supportive housing, it would be a state budget item.
Yep.
That would come from the state dollars.
So it's informational emails, not, do we have to like sign something, or you that will support this effort, but we're not financially supporting it?
So what?
Sure.
Well, I was just going to say, commissioners, when this has come up before, and it's kind of confusing, so basically the housing developer needs a sign off from the county's Health and Human Services area, and all we're attesting to is the fact that we have a need for either housing for people with disabilities, or we have a need for people with housing, and then, homelessness types of things. And then what they would actually get some of their funding through is through some subsidies from the federal government for providing this type of housing as part of their regular rental area. So they would be renting out to the general public and asking for whatever their rent that they would be requesting there, but they would hold aside some of these other apartments for these more specific needs, and they would get not funding, but I believe like subsidies, through the federal government.
So-
Mr. Chair,
Yes, Commissioner Witter.
so are these apartments, are they furnished, or is that part of the subsidies that they can get some money to help them get like a used couch, or, they must have a refrigerator and a stove, or?
Yeah, they would just be set up as a basic apartment that anyone would rent. So they wouldn't be furnished, but they would come as if you went and toured an apartment. It comes with, a stove, a refrigerator, those kinds of things, anything built in, but nothing additional, no additional furniture, and the subsidy does not provide for that. But if it's through housing support, the housing support entity that is assisting that individual in the housing must ensure that the individual has certain criteria. So a place to put their clothes, a bed, those types of things. And that's up to the housing support provider, not up to us as the county.
Okay.
So, Mr. Chair, the
Yes,
limited that
Commissioner
I know
Vetch.
of these type of facilities, largely from my understanding, that they want, some of them want as little as 10%, some one of them want as much as 25% of their units to be this. And a lot of it is because it allows for them to illustrate to their lender that they have guaranteed revenue through the federal government for 10% of their units or 25% of their units. It's more to show to that their performance shows well when trying to get their application through a lender. That's some of the reasons that. So applying to HHS, any county in the U.S. can say that they have a homeless need. I'm sure there's not a single county out there that would probably say they don't have a homeless need to some capacity. So.
Well, some of it, like workforce housing, the county has to sign off on approving that because it's state funded. Some of it is, or there's some state funding involved in it. So we've had to approve or sign off for the 3 in St. Michael. I think there was one in Rockford.
The current ones for long-term homeless units are just in Buffalo and
Yeah,
in St. Michael.
We approved the one, by the courthouse there, by the fire station.
Okay.
That has,
Yeah.
Yes, a low
7
apartments,
beds
7
or-
individual long-term homeless units.
so we have,
Yep.
And they've been
Everything's there.
filled consistently throughout this whole period that since they've been open. They've kept those filled the entire time since they've been open, is my understanding.
Well, I know we asked HHS to check on the ones that were in St. Michael, and they checked, and those were all full. But again, we have no control on who's
Right.
Yep, we're kind of part of it in this early process, and then we're not as much a part of it. We do have a housing coordinator now, a position for a housing coordinator that we're still trying, which I think you also heard about at AMC, through some other counties that are working in that area. It's not a dedicated position, but it's somebody that we'd like to kind of get closer to this whole area.
Do you folks notify the particular city that this resource is now available or will be in case somebody should knock on their door at the particular city and
I know
say,
they're showing up at a lot of city council meetings. I mean, they have a process, I believe, just for zoning and those kinds
They're
of
going to
things.
the
So,
planning commission in each one of those municipalities as they go
so
through.
we don't take it on ourselves to notify the city, but part of what they're doing would include that.
No, I think that's good to make sure somebody does, and if we're supportive of it, it wouldn't hurt that we send that out to them. Because I reached out to a couple city administrators where this was proposed to see what they had any thoughts, and they said, oh, we support the effort. It didn't sound like they were really in the loop that knew it was there or coming there, but
Okay.
if we're in support of that, I think it'd be good to let the city know it's there if you have the need, just to make sure that link is made.
Mr. Chair,
Yes.
in the case of Buffalo, they're the ones that came to the county.
Oh.
So they were involved kind of from the beginning with this apartment building complex going up. So and that was part of their common hopes, needed to provide like 7 homeless or apartments for homeless people. So, so they're definitely, cities might be part of the initiating force. So, yeah.
All right.
And I can give a summary of the units if you'd like, the current projects.
I'd like to know how many
Yeah.
are actually in Wright County.
Mr. Chair.
Yes, Commissioner Witter.
Commissioner Dahlheim, I think the apartment buildings you're thinking of are the ones when you cross the river towards the cities. And it'd be like going to Lake Rebecca and that. They were considered low income.
They'll not be as in the Hennepin County side then.
Yeah, so, yeah, some of these that are like on the Hennepin side, you wouldn't have anything to do with anything with them, right?
We would not, no.
Okay.
All right. Anything else? All right, thanks, Diane.
Thank you. A couple of other things that have come up, I just wanted to keep you in the loop that our continuation of services for our First Steps evidence-based home visiting grant has come due again. I believe it was just submitted today. It doesn't need board action, it's just continuing. However, it is 2 FTE, that's $329,000, I believe, and that supports 2 FTEs in our public health area. So that's going forward again. We had the opioid settlement seminar. I don't know if any of the commissioners are able to join us. This was, I believe, last Monday. Sounds like, based on what I heard there, the first payment could be received as early as July. Don't hold me to that, but that was some of the discussion during that webinar. I think this is a fantastic announcement. We did receive a letter from DHS. Now I probably can't put my hands on it. It's an administrative DHS admin review finding on a Dnmc, and if you recall, that does not meet criteria for a hospital stay, and that's when we get a notice from, let's say, the Anoka treatment place that we have a client that's a Wright County client staying there, and once they no longer meet hospital level of care, then the county's on the hook for, I think it's about $1,300 a day for their care until we can find a place for them to go. Well, we actually had received a letter from them saying that, and then oftentimes we'll appeal that and say, well, you know, this is the plan, we do have a place for them to go, or whatever the situation is, and they can agree with our plan or not agree with it. Well, this is the first time I've ever come across this, but the letter that we received back said that at the time, this individual, they did not like the plan that we had come up with, and so the person stayed there, and the county was paying for their care while they were there, only to find that later, we received the notice that, here it is, the finding was that while the patient was not ideal, based on the findings, it was determined to be safe that the patient could have been discharged sooner. Therefore, the finding of the commissioner is that the cost of care liability for the county will be reduced to 20% of the cost of care per diem rate as of 11/29 through the patient discharge of February 11th. Well, in any event, all of that means that the county is receiving back from the state $95,608, so close to $100,000 for the care of one individual that will be reimbursed for because of the work that our folks did, kind of making sure that we had a place for them to go and that it was a good situation for them.
Well, the issue
Good job.
is that there's no place for them to go, there's no beds available.
Right.
So we're stuck between a rock and a hard place.
So in this case, we did have a place. They didn't
But
agree
they
with our
didn't agree.
placement, right?
But
And then-
again, we were probably limited
Right.
to where we could send the person.
And this was like November through February. And I agree with you, Commissioner Delighten. We do end up in that situation where we don't have a place for them to go. They no longer, and sometimes our argument is, we think that they do still have a level of care that requires a hospital, which is why we can't find a place for them to go. Because of their behaviors, no one will take them, so we think it should be a hospital. And that's where we often lose, and they just say, nope, doesn't meet it, you know, they're being discharged and you would need to find a place. And if they stay here, we pay that premium price for them. So kind of two sides of an issue, I guess.
Is that when we should take them to downtown Minneapolis so that they can find a place in the Hennepin County Homeless Center?
I'm not making any comment whatsoever. I also wanted to let you know that we are looking, and I talked with Sean Johnson about the first of these two positions, but AmeriCorps, this is not that RSVP situation where we have somebody working up on the second floor working through Serve Minnesota. This is a separate program where they're providing fully funded positions for a year to not just Health and Human Services, but to public health types of activities that happen in different parts of government. We are looking at potentially bringing on board somebody to work in our environmental health services as we try to figure out where that effort is going to reside and what that's going to look like. So environmental services, and also thinking about asking for a position under communications that would really ease the burden on our staff around things like COVID, opioid, and mental health issues around communication. So that's just something that's in the works right now.
Mr. Chair,
Yes, Commissioner
did you
Deline.
say it won't cost the county a dime?
I said that they were fully funded positions.
Because they were talking about those at the
5,000.
district meeting, and it was $5,000
Yeah.
cost to the county
Yep.
for each person.
So we met with AmeriCorps on Friday.
Sarah, would you step up to the podium, please?
Apologize. We met with AmeriCorps staff from Serve Minnesota on Friday, the 27th. Does that sound about the right date? May 27th, and they were in the process of determining whether or not there will be a $5,000 fee or not. But we can use our COVID grant to cover the $5,000 fee.
So I mean, if I can hire a person for $5,000 for full-time work, and that's all, and it's not my employee, yeah, I'm all for it.
Yes, we don't manage any of the, we sign off on their time cards and that is it. All of their payroll, all of their insurance, everything is handled by AmeriCorps.
Yeah, hearing that at the meeting this morning is like, that's really exciting.
Yeah.
Yes.
How many years of salary will they cover?
It's 1 year upfront.
So it's a 3-year, AmeriCorps programs, they employ the individual and they renew each year. And so we could also apply each year for another position. So we could continue on for the 3 years that they have the public health program. But we might not have the same member each time. Each time they complete a year of service, if people are familiar with, it's sort of like a national service program, right? So they get tuition credit, they get payment, health insurance, and then on-the-job training. Many of them are new graduates from college.
Thank you, Sarah.
All right, thank you.
This is just a reminder, board, that HHS is having an all-staff training next week on Tuesday, on June 21st. That was continued from we were doing it in March over in these rooms, and they weren't quite ready yet, so we're doing it after board next Tuesday. Actually, I think after board workshop. Nope, this is board workshop tomorrow, right? After board on the next Tuesday. And we'll be bringing all of our HHS staff in for an all-day staff training, for, all day meeting 10:30 in the morning till 4. We'll be open for emergencies only, but otherwise we'll have all of our staff under one roof getting the same training at one time, which is like probably the first time in about 8 or 9 years that we were able to do that. So we're looking forward to that. And you certainly are welcome to stop in and see us.
Where will that be, Jamie? At the other building?
Nope, all here. These, I think we reserved the 3 rooms over here, and I believe we might be reserve this room to operate the technology for those rooms.
So potentially over 200.
Over 200.
All right.
And then finally, I just had an update that I believe Michelle Miller would like to provide. We have an employee, Robin Dorff, who recently moved into our recruitment position for foster care families, and she's been doing a great job, just really getting into the whole thing and finding folks for us. And Michelle would like to give you an update on that.
So you may remember Robin Dorff was our truancy case aide, and in November she moved over into our recruitment area. So she does part-time recruitment and part-time kinship work, so looking for relatives for kids who are in out-of-home placement. So keep in mind, this is only 50% of the job that she's doing. Since November, she has hosted a table at 9 community events, spoken at 5 schools, 3 organizations, 2 chamber meetings, and done a radio spot. We are on track to more than double the number of new applications that we had last year, which is pretty exciting. We also, we've been working on an on-call emergency placement for kids who need shelter, so that's typically 72 hours. We have several foster homes that are currently providing care to teens, which is, I mean, if you guys have heard me talk about foster care and recruitment, we always need more homes for teens. So that's a huge success. And so far, we've only had 1 youth that was in one of our shelter homes, so a family foster home, who actually needed to go on to a higher level of care, meaning not family foster care. Otherwise, we've been able to provide the care here in the county with those that we have licensed. Yeah. So Robin, she had been our truancy case aide, I believe it was like 11 years. So if you can imagine, like all 10 school districts knew Robin. Like Robin was kind of the face of truancy. And so she is using all of those wonderful connections and relationships she has to benefit our foster care recruitment. And it's obviously, we're seeing the success already. Yeah.
Nice.
So we just wanted to update you. I should have brought some of the pictures. Do we send them our newsletter? Because we're gonna have pictures of Robin like all over the county in our HHS newsletter. So we'll see if we can send them out. It's just really fun to see and just see kids and adults interacting, and yeah, it's really been a good thing for us.
And there's more and more expos and events you see advertised all over, of opportunities to set up booths for any kind of project.
Yep.
Thanks,
Yeah.
Michelle.
It is really nice having the momentum going in this area. We have just, and Michelle mentioned the teenagers, we just had really nowhere to go with these folks. So it's really great that we're getting some traction there. So I wanted to share that good news. And that is all I have for today, Board.
All right.
Mr. Chair,
Yes, Commissioner Wetter.
when you were talking about the opioid settlement, have you decided on, or had some ideas on how you might use some of that?
Well, I believe that we're going to be coming to a committee of the whole with the information we had from the SHIP survey and what people were, am I getting my ARP money and my opioid money mixed up, Sarah?
So we presented at a workshop in May, and then we're going to get an update. I think we were thinking the beginning of July. So we're in the process as we've moved from the new SharePoint platform to develop the application process for the opioid advisory committee, for lack of a better words.
And you'll come up with all the criteria and all that kind of thing. for
Yep, all of the
application.
different folks so that board yourselves can send out the application process to, any community partners that you think would be interested in being on that. There may be providers in your area that you would want to apply. And then we have to invite our cities as well. So we'll get that.
Yep, so it'll be an effort that'll be with us for probably a couple of years.
Yeah,
Yes.
Well, it is an 18-year.
18 years.
yeah, well, I realize that, but thank you. I was just curious where you were at in the
Yeah.
planning.
I
or-
would say kind of beginning, but, I think that we're just looking for direction going forward, and I think this is what the committee will provide us, so we're looking forward to having
Great.
that.
Mr. Chair?
Thanks, Sarah. Yes, Commissioner Dolan.
No, go ahead. You were going to talk first.
Oh, I already thanked her, so go ahead.
Oh, that's what I thought you were. Have we found out, is it going to be 18 equal installment payments? Is it going to be a lump sum up front and then, have we heard yet at all? Okay.
I can almost guarantee you that it won't be 18 years of the same equal payments. At least one of the companies settled with a front loading of the first, I think, 7 to 8 years. So it'll be more upfront. And then even the number that we have will, of that 3.77 million, will be adjusted slightly. While we were in the works of our state-local agreement, that's when, if you probably remember some of the news, the bankruptcy judge kind of threw out the Sackler agreement, and then they went and did another one that was, again, it was nothing, it was to, I think, inflict more recovery and damages onto that settlement. So that more money, but it won't, I asked the Attorney General one of those, a similar question about how much that might change our settlement amount, just so I could have an idea to let you know. But they kind of, I think the overall settlement at the federal level is several billions of dollars, and this impacts it like on a scale of like several million. So think of it changing the decimal point just a little bit.
Sarah's been invited to come up to Duluth, I think, later this week as part of that ORAC group.
I'll go in July.
Oh, in July,
yes.
okay.
But I was just invited to the ceremonial bill signing for the opioid bill tomorrow.
Cool.
Good,
So we might see her in a newspaper somewhere, or online more likely these days.
Take pictures.
yeah.
I will.
Thanks, Sarah.
Get a pen.
Anything else from the board? All right, we're adjourned, 2:13. Thank you.
Thanks, everybody.